So, ayan. Day 2 mga Kurdaps. Day 2 ng home quarantine. Lockdown na tinatawag. Pero silipin nyo yung labas mga Kurdaps. Dami naman nagsa-shopping. Hindi, gross. Supermarket open. Kaganapan mga Kurdaps. So, day 2 natin sa pagiging quarantine. Ayan. Dami pa rin namang sasakyan sa grocery sa counter. Dami pa din nagsa-shopping. Kanina may pila dyan. Ngayon, tumigil na dahil umulan. So, ayan. Ayan. So, ayun. Ayan. Ayan, may news si Prime Minister. Manood tayo ng news. Let's watch the latest news here in New Zealand, mga Kurdaps.
In my bubble, and I'm in his bubble, because we are in proximity to each other so often. But just for the purposes of ensuring that we're also modelling best practice, we will be moving further apart as well. And a couple of updates, and then a thank you. Over the past few days, we have been discussing the importance of personal protective equipment, or PPE as it's called, for our frontline health staff and also for our essential service workers. They are looking after us, and so we in turn need to make sure that we are looking after them. So I wanted to give you a few more specifics around our PPE stock in New Zealand. The Director General of Health, you may have seen, included in his press statement this morning some of the stocks that are currently held in New Zealand. DHBs hold 5.1 million masks, 1.9 million gowns, 2.7 million pairs of gloves, and 60,000 items of eye protection. In addition, the Ministry of Health has a national reserve of 18 million masks. Yesterday, 640,000 masks were released from the National Reserve, and today I'm told were sent to DHBs to replenish their stocks. Over the next month, the Ministry of Health will be supplying 4 million masks to the health sector and a further 4 million masks to non-health sector essential workers. We're also working closely with a Whanganui-based manufacturer of masks who helpfully in New Zealand produce 60,000 masks a day and 45,000 what are called N95 masks. Those are masks specifically used by our health workers and the next level above the surgical masks that you might see day to day. We are actively assisting them, I'm advised, with distribution logistics so that they can focus entirely on production. The Ministry of Health is compiling a priority list so essential workers at the most risk of contracting COVID-19 receive masks and personal protective equipment first. DHBs have been given refreshed guidance on the appropriate clinical use of PPE to help them plan usage and ordering. As you may have heard me mention yesterday, we still have some work to do with the distribution aspect of PPE. But I know that this is a priority for those who are leading our response operation, and will include the normal supply networks and working with new private sector support to just continue to grow our PPE stocks. I also wish to follow up on some of the points that Director General Ashley Bloomfield made earlier today about the continued rise in the number of 19 cases in New Zealand. As I have said many times before, sadly an increase in cases is expected. In fact, it is the whole reason why we are in a lockdown. What we are seeing now are the cases already in New Zealand before that lockdown started, and these will keep showing up each day and will continue to rise for at least 10 days or more, and I'm expecting that those increases will continue to be steep. However, if we keep to the lockdown rules and limit our contact with others, we should start to see the impacts of that, if we follow the rules. I want to remind people again why it's so important. If you today have COVID-19, you may not know that for several days. Say in that time you decide to walk with a friend, not in your bubble. That friend then visits a family member, not in their bubble. That sets off another chain of transmission that will still be showing up weeks from now. So I say again, please stay home, break the chain and save lives. I also want to use these briefings to draw attention to and acknowledge some of the extraordinary efforts essential workers are undertaking in the fight against COVID-19, and there are many unsung heroes across New Zealand. I will do my very best to acknowledge just some of them as much as I can. Today, I want to single out our medical lab scientists, a workforce of 1,823 at 8 labs across the country, processing incoming tests 24 hours a day, 7 days a week to get the job done. They're on separate shifts and separate teams and on rotating rosters to help preserve physical distancing and stay safe as they carry out this vital work to help in the tracking, tracing and elimination of COVID-19. And while their work is around the clock, it is also continually notching up their gear. As testing ramps up, which in the last 7 days has averaged 1,479 tests a day, so too must our labs, with 3 more currently being set up. These lab staff are working tirelessly to ensure we know the true scale of the outbreak and to ensure those with COVID-19 know and get the appropriate care. I want to say on behalf of New Zealand, thank you for your work. I'll now hand over to the Minister of Finance, Grant Robertson, who will give us an update on the implementation of the wage subsidy.
Thank you very much, Prime Minister. Work completed at the wage rate agreed between you and your staff. We have had a lot of questions about leave. The scheme does not change any legal obligations employers have. Employees should not be compelled to take their leave to receive the subsidy. We are running this scheme in a high trust model in order to get money out the door to support workers, families and businesses who are affected by COVID-19. We will soon begin publishing the names of firms who have received the subsidy as indicated to them when they applied for the subsidy. As I said yesterday, I want to hear from anyone who believes an employer is taking the wage subsidy but not passing it on to their staff. This is a high trust model and we need to work together to get through this and be ready for when the economy begins to recover. I just want to say 2 other quick things before I finish. The first of those is to update again on numbers in terms of what has been done. As at this morning, $2.7 billion has been paid out to 428,768 workers, and this includes 58,741 self-employed people. I need to stress again that the demand for the scheme is very high. People involved at MSD are working hard to respond and process applications as fast as they can under challenging conditions. I want to again thank the Minister of Social Development, the Honourable Carmel Sepuloni, the Chief Executive of the Ministry of Social Development, Debbie Power, and all their staff for the extraordinary work that they have done to process that many applications. It is important for everybody to try to be patient and be kind to one another. All of these people are working as hard as they can. And just on one very minor point, if I may, Prime Minister, just to confirm something I believe Patrick asked yesterday, the mortgage repayment deferral scheme is open and underway. All the banks are taking applications for that from today.